Ear fungus, also called otomycosis, is a condition that often begins silently, but can become extremely uncomfortable if left untreated, and many people mistake it for simple earwax buildup or a bacterial ear infection, when in fact it is caused by fungal organisms such as Aspergillus or Candida that thrive in the moist, warm, dark environment of the outer ear canal. The human ear is a delicate organ made up of the outer ear, middle ear, and inner ear, and the outer canal in particular is designed to protect itself with a thin lining of skin and cerumen, or earwax, which contains natural antifungal and antibacterial substances. However, when this balance is disturbed by overcleaning, excessive moisture, trauma, or long-term use of topical antibiotics or steroids, fungi can colonize and grow, leading to what is clinically called otomycosis. Patients may notice persistent itching, a sensation of fullness or blockage, discharge that ranges in color from white and gray to yellow or even black, mild pain or discomfort, and sometimes muffled hearing. Unlike acute bacterial infections, which typically cause severe pain, swelling, and fever, fungal infections tend to progress more slowly, but can be equally distressing if ignored. Diagnosis is usually made by a doctor or audiologist, using an otoscope or microscope to examine the ear canal and eardrum. And in many cases fungal spores, filaments, or characteristic debris can be seen clinging to the canal walls. In some cases, laboratory testing is done to confirm the fungal species, especially if symptoms are recurring or treatment resistant. The cornerstone of treatment is professional ear cleaning, because unless the fungal debris is carefully removed, medications may not penetrate effectively. Doctors often use suction devices, micro-instruments, or controlled irrigation to gently clear the canal of fungal material, and this procedure is far safer than trying to insert cotton buds or foreign objects at home, which can worsen the infection by pushing debris deeper or damaging the canal skin. Once the canal is cleaned, antifungal ear drops such as clotrimazole, miconazole, or acetic acid are prescribed to eradicate fungal organisms, and patients are advised to keep the ear dry by avoiding swimming, carefully covering the ear during bathing, and never inserting sharp objects or cotton buds. In more severe cases, antifungal creams or oral medications may be used, particularly in patients with diabetes or weakened immunity, where complications can be more serious. Untreated otomycosis can lead to thickening of the ear canal skin, recurrent blockages, persistent itching, and in some cases even spread to the eardrum or deeper structures, which is why prompt professional treatment is crucial. Prevention strategies include keeping the ears dry, allowing adequate ventilation by removing earbuds or hearing aids regularly, avoiding overcleaning that strips away protective cerumen, and managing underlying conditions like eczema or diabetes that predispose to infection. Importantly, people should be educated about what not to do. Home remedies like pouring vinegar, hydrogen peroxide, or oils into the ear can cause irritation, especially if the eardrum is perforated, and inserting keys, hairpins, or cotton swabs risks serious injury. The safest approach is always to consult a professional if itching, discharge, or persistent discomfort occurs, because correct diagnosis and treatment provide relief and prevent recurrence. Otomycosis, while common, is highly manageable with the right care, and by respecting the natural defenses of the ear canal, patients can avoid chronic problems and protect one of their most vital senses. Hearing, earwax, or cerumen, is another topic that generates a lot of misconceptions, because while many people view it as dirty or unhygienic, in reality earwax is one of the body's most effective natural defense mechanisms, produced by glands in the outer ear canal and made of a mixture of secretions, oils, and shed skin cells that work together to trap dust, debris, and microbes, preventing them from reaching the delicate eardrum. Cerumen also has lubricating properties that prevent dryness and itching, and it contains natural, antibacterial and antifungal elements that inhibit the growth of harmful organisms. The ear is designed to be self-cleaning, with chewing and jaw movement, slowly moving old wax outward where it can be wiped away. But sometimes this system fails and wax accumulates, leading to blockage. Impacted earwax can cause symptoms such as hearing loss, tinnitus or ringing in the ear, earache, a feeling of fullness, or even dizziness in some cases. Causes of wax buildup include narrow ear canals, excessive use of cotton swabs that push wax deeper, wearing hearing aids or earbuds that block natural migration, overproduction of wax, or certain skin conditions. The safe way to manage earwax is to avoid inserting objects like swabs, matchsticks, or fingers into the canal, since these often push the wax further in and risk injuring the eardrum. Instead, professional removal methods are recommended. Doctors or audiologists may use microsuction, specialized curettes, or gentle irrigation under controlled conditions to clear impacted wax. Over-the-counter ear drops containing hydrogen peroxide, carbamide peroxide, or olive oil can help soften wax, making it easier for natural expulsion or professional cleaning. However, drops should never be used if there is a history of ear surgery, ear tubes, or a suspected eardrum perforation, since introducing fluid into the middle ear can cause serious complications. Ear cannling, a popular but dangerous alternative therapy, is strongly discouraged by medical professionals because it is ineffective and carries risks of burns, blockage, and injury. The safest advice is that most people do not need to clean their ears at all, as routine washing of the outer ear with a damp cloth is sufficient, and wax will migrate out naturally. Intervention is only needed when symptoms arise. General ear cleaning practices for maintaining healthy ears involve keeping the ears dry, protecting them from trauma, avoiding excessive insertion of devices, and seeking medical evaluation if pain, hearing loss, or discharge develops. Together, understanding the truth about ear fungus, earwax, and safe cleaning practices helps patients make informed decisions, avoid harmful habits, and maintain ear health throughout life. For voiceover purposes, the take-home message is clear. The ears are self-regulating organs with built-in protective mechanisms, and the more we interfere with them through unsafe cleaning or neglect, the higher the risk of problems like otomycosis or cerumen impaction. By respecting the ear's natural defenses, using professional cleaning methods when necessary, and following preventive measures such as drying the ears after swimming and avoiding unnecessary swab use, people can preserve comfort, prevent infections, and protect their hearing, which is essential not only for communication but also for balance, safety, and quality of life.